area that we cannot explore in just 20 minutes. So you're welcome. I will not use the video. So if you have anything, please either put it in the chat box or later on you raise your hand so that we can talk about it. So here we go. That is the kind of picture that you see in the counseling room when you are working with children. And so many people are wondering whether children have any anxiety during this pandemic. I want to say that I will have this presentation in different small subtitles. The structure will be, first I'll define what anxiety is, then I will discuss what is happening right now. This will be based mainly on what I've seen through the counseling room and what's going on. I will also talk about what the contributing factors to anxiety in children during this time are. And eventually I will talk about how, as a counselor, you will help the parents to notice anxiety in children. And then we will talk about pointers for counselors and caregivers. And there it is. What is anxiety? I will define anxiety in the simplest terms according to what is happening and what you see. Anxiety is the body's natural response to perceived, to anything that is perceived as stressful or dangerous. As one experiences anxiety, there is a tendency to overestimate the perceived danger. So whenever we perceive, remember it is a perception that things are dangerous. And most of the time, there's a tendency to overestimate that perceived danger. So you can imagine a child who thinks that there is a monster in the room, and he will say the monster was near his bed, but when you come around, you tell them there is no monster. That is the perception of the child, is that there is perceived danger around him. What we need to know is that whenever anxiety is unchecked, it can cripple a person's effectiveness because the what ifs can overpower reality. Most of the time, people that are anxious will say, what if? And the if is greater than what is the reality. That is to say that anxiety is often fears of things that are not there, but for a person experiencing anxiety, the what ifs is bigger than the reality on the ground. Anxiety in children ranges from excessive worrying to crippling panic in stressful situations. On average, many children experience some form of anxiety. So you will see that children, any one of you who has been a child, and I think every one of us has been, have always been anxious about things that you thought were so big, but when you look back, you realize they were just childish things. If maybe you fear that your mother will find out you tore your uniform and you make it look very big, that is a kind of anxiety. But when mommy found it, she cleaned it, maybe made some small noise, and there was nothing so big compared to the panic that you had experienced because you perceived that it was the biggest thing that has ever happened to you. So what is happening right now during this COVID-19? In the child's world, there are a lot of things that are going on, but most of us as adults forget that the child is also part and parcel of the COVID-19 pandemic. They are hearing, they are seeing, they are perceiving certain things. So one of the things they have already had is tonsembera, social distancing. They cannot go near their friends. They can see their parents not greeting. They cannot hug strangers. You know, that time they could hug an auntie who comes anytime. So that social distancing. They cannot jump onto their grandfather's lap if he comes, as they used to do before. Then there is this idea of working from home. They knew that fathers and mothers have offices, but now they are seeing fathers and mothers at home, and probably the mothers are yelling, keep quiet, I am in the office. The father is, I want silence in this home. I don't want you around. The younger ones don't understand why, when their fathers are home or their mothers are home, why they can't hold them and play with them the way they think it should happen. There is online learning. This monster of online learning. Some schools are sending a lot of information to the children who we know in our context were not even allowed to handle computers or phones, but they are now expected to learn a lot from the online platforms. There is also a lot of information. There is also a lot of information overflow. People are talking about dead people in the hospital. They are talking about COVID will kill everyone. There is a lot of things going on in terms of information, okay? There is boredom. Since they closed school, they cannot play freely with their friends. They cannot go to the neighbor's place. And so they are locked in and they feel very bored. There's limited access to things they can do. And even when they are done, there's still a lot of time in their hands. And to make matters worse, the adults are there. So the adults are watching the football, they are watching the soaps, and they are not giving the children time to even watch their TV programs. So it's a lot of things. Then there is the unpredictable future. When are we going back to school? Who is going to help us in our work? Is this pandemic going to get finished? The candidate classes were looking forward to prom, and now they are going to miss out on the first suit, going to miss out on the best evening wear, miss out on making a friend. So this unpredictable future is fueling the anxiety of children, okay? So let's look at the contributing factors to anxiety in children. Many children, some of them are very, very anxious because the parents are modeling anxiety. You hear them talk on phone and they say, Mama, tufude, you know, the first one has died, the second one now, this country, you know, they keep talking loudly in the presence of the children, and they themselves look very anxious. When they are going out, they make it such a big thing, and the children are seeing that. So the anxiety in children can also be contributed to by the parents who are modeling their anxiety. Then there is the overprotective parenting. You know, we are not allowing children to be children at all because they're saying, oh, don't touch this, don't touch that, wash your hands, wash your face, remove your clothes, you've been outside, or who are you with? And so the children are very, very hyper vigilant. They don't know what to do, and they are not sure whether they are safe. And even simple greetings or a simple flu, the parents become very, very scared. My child is coughing, and is it COVID? So overprotecting parents are also contributing to the anxiety in children. Another is the low household income. People in the low household income places give a lot of unpredictability for children. They already lack a lot of things, but because their parents cannot afford even a mask, you know, masks were given to adults, but if you want to go out with your child, you would feel safer with a mask, but the parent cannot afford it. So the fact that even there is no food, not enough food for the next time, and the parents are saying, you better eat little, we don't know what's going to happen, that one is fueling the anxiety. Then we have multiple siblings. Whenever there are many children in one household, they tend to bully one another. They tend to tell each other secrets. They tend to tear each other apart. And if one person coughs, they think, oh, you have COVID, and they can isolate. So when there are many siblings in the house, the probability of anxiety going up, because many of them interpret different situations differently, and then they communicate it to all the other children. It becomes a factor in anxiety. Another is the family conflict. We know now that the lockdown made people share small spaces, and because of that, they could have rubbed each other wrongly. And so the children are wondering whether their parents are going to stay together. Their parents fight when they are together in the small spaces, so they don't feel safe. And so their anxiety keeps going higher and higher. Last but not least, there is the isolation bit. The children are not able to play. They are not able to go out and release some of the tension like they used to do in most of the homes that you people come from. They are not able to meet with their schoolmates and talk, especially the adolescent kids who have limited friends, and they only depend on the schoolmates. Now the schoolmates are not able to freely communicate with them. So their anxiety levels go higher because they cannot share their frustrations freely. And then we have the what we call blocking the children out from their friends, because we don't want them to have access to media, and we are afraid it will do a lot of damage. So how do you notice anxiety in children? This is for you, the counselor, because the parent will come with a child who is unwell, who is sad, most likely who is not eating well, and they are worried about their mental well-being. But as the counselor, you should have some signs on your fingertips that you should talk to the parent about, and even to the older child about, to show that you notice anxiety in children. One of the things is the questions they ask. Many of them will say, will we get corona? You know, did so-and-so die of corona? Just to fuel their curiosity, but also to try and test the waters and see whether they are in danger. Some of them will have the activities they engage in. You will hear them playing if they have more than one sibling in the house, and you will see them playing ambulance. They will play a sick person, and they will say, oh, they have corona. Some will play funerals and all that. So some of the activities they engage in will show you that this kid could be anxious. And another is that some of them can have nightmares. They don't want to sleep alone. They want to sleep with lights on, or they think that some animal has come. You know, that picture of the virus, it looks like a big round circle with hammering things around it, and it keeps coming on TV. It keeps coming on TV. So they can imagine they are seeing it in their sleep, and that can cause them to jump or to feel very uncomfortable and sweat through the night. Some are unable to concentrate on their work. So mostly what happens when the children come for counseling is that the parent will say, my child is not serious. They need to be helped to get serious, to do their things, to do their work, and so forth. Yeah. Then they will, you might have some of them having very poor eating habits that they did not have before. You will see your child every other minute, they're running into the kitchen to pick up something to eat, even when you know that you fed them well. Why are they coming to eat? Eating can be a comforting thing. So you might find your child eating and nibbling things more than normal, yet you know that you have fed them very well during the meal times. So if you see that, it's not because you have enough good food, but it's because it is easier to comfort yourself through eating. When children have constant negative thoughts about themselves and about everything that is going on around them, you will see a child coming in and saying, I want to see my friends. My friends are not talking to me. Or maybe I am not smart. Or I am feeling headache. You know, they keep giving you very negative evaluations of themselves and of everything else in the house. They are saying, this person doesn't like me. They don't want to do this. The maid doesn't want to give me food. They have imagined, sometimes real, but most of the time they convey the negative thoughts. Another thing that you may help a parent to notice as a counselor is when children are irritable, angry, and acting out to parents and to siblings and to other people that they live with. The kind of children that have been brought for counseling during this COVID-19 outbreak have been children that have been fighting with their siblings, fighting with their parents, and fighting with even the house helps and everyone else. They can see nothing that is causing them to fight. So when I talk to these children, I find that they are really anxious because they don't know when they will meet their friends. They want to go out and maybe play basketball or something, but they fear to contract COVID. And when they come home, they have so much tension, and the parents are also irritable. So they might snap back at them, especially the older children, and you see them locking themselves in their rooms. So they are angry and they are acting out to parents. They don't want to eat at table. They want to eat in their bedrooms. And so when you put in your rules, they are bent on breaking those rules. You notice that that is a child that could be having anxiety. They have perceived danger. Then there is insomnia. They are not sleeping. Teenagers especially want to stay up and occupy themselves with certain things. The truth is, some of them, the levels of anxiety have become so high that getting to sleep is not easy for them. So ask questions around this when you are talking with the significant caregiver of a child. There are many other things that they can show, and we can discuss that, but we don't have enough time. Some children will wet the bed, and most times children wet the bed when they are anxious. So if your child has been wetting beds more than normal, it's some sign that there could be some anxiety issue somewhere. Yeah. So what do counselors and caregivers do given this kind of situation during the COVID-19? And these are what I would like the counselors to pick up and educate the caregivers so that it is easier to manage this anxiety during the COVID-19 pandemic times. Parents and caregivers should check the expectations of their children. Ask the caregivers and the parents what they expect of their children during the COVID-19. All of a sudden, parents are giving responsibilities out of the blue that children are not used to. and the children don't know even how to navigate around them. And because they are having longer times with the children, because they work from home, they are noticing certain things about their children, and they don't know when their children learned this. So they should check their expectations. I usually tell the parents to be to be as careful as possible. Sometimes we give children, we expect too much of the children, and they get overwhelmed, and then they want to work according to what you want, and it overwhelms them. Another thing is to stay calm and informed about anxiety in children. So this means that the counselor should educate the parent, give them some psycho information so that they can always make informed decisions about their children, about anxiety, how children are anxious. Parents sometimes tend to not think that children can have adult issues. So help them to stay calm and very informed about anxiety in children. And you, the counselor too, when the child comes in, usually the parent has informed you of what is going on, and you can easily be triggered. But your job as a counselor is to stay very calm and then get very informed about anxiety so that you can discuss with the child in a calm manner what is going on in their lives. Another is to help the parent to establish rules and boundaries to direct the children. COVID came very suddenly, and all of a sudden families were found together, and they were supposed to continue working, continue going to school without an established routine and all that. So it's very important that you help the parents to establish rules and boundaries around the COVID-19 issues. For example, if you have 4 and 5-year-olds and they have seen mommy at home for the first time in a full week, staying there 24/7, they would love to sit on mommy's lap, they would love to eat with mommy, they would love to report their friends. Yet, mommy needs to be on Zoom to talk with her boss in the office. So it would be nice to tell the children that, you know, every day from morning to lunchtime, I will stay in the room working, and I will hold you later. So help the parents to establish those rules so that the children are directed in a good way. Also, they help the parents to keep information simple, reassuring, and clear. That goes also for the counselor. The information out there is big, it is complicated, it is conflicting, it is scary for children. So when they hear something on TV, somebody is saying, oh, people are dying, people are dying. So the child will say, so daddy, are we also going to die? Don't say, who told you that? Sit down and say, oh, you are scared about dying. So help the child to understand that the death is not running after them, that it's going to kill them. So keep the information simple, reassuring, and clear. That means that parents will have maybe to keep off social media, keep the TV stations, that those gutter information that doesn't help to calm the child. Then help them to establish realistic schedules and structure. You know, children thrive where there is structure. Even if they are going to wake up a little later, parents should be helped to make schedules for the children. And if possible, especially for the older children, to involve them in making the schedules. A teenager would like to sleep maybe up to 8, and there is enough time to sleep up to 8 these days. So from 8 o'clock, what are they going to do? help the parents not to make the structures for the older children, but to involve the children in making the schedules and to put in place structures for them so that they fall in line rather than just throwing expectations at them. The children get very confused. So even if it is eating, even the parent should also follow a structure. If they are working, help them to wake up, dress up like they are going to work so that the children can have a boundary that mommy is ready and dressed like she is in the office. That way, it will help the child, make it easy for the parent, and the parent make it easy for the parent, for the child, so that the anxiety levels can be lower. Then another is that many children come up with feelings. They are crying, they are anxious about what's going to happen in the future. They fear, they have heard that their parents are going to lose jobs. So they have all these fears. When children come to express those fears, help the caregivers and the parents to validate children's feelings when they express all those fears. Why? Because parents tend to invalidate children, to say, you should not be scared of that, but they should be able to tell the child, oh, I understand why you fear that way. And then, and I am with you when you are sad that this will happen, but also reassure them that it has not happened, and if it happens, the parents will be in charge. Another is to provide an opportunity to connect with family and friends. I talked about children being isolated during this time of COVID. So, and so most children are away from their friends. They are away from the familiar activities that they used to have. So it's very important that you ask the caregivers to provide opportunities to connect with those family and friends while adhering to the basics of avoiding COVID-19. One of the things can be call the grandparent, call their friends and talk to them. You know, it's not bad for your child to connect with their friends so that they can maybe call one another once a week. You can arrange a good play date if you know that your friends are safe, and the children can play for certain times and then come back home. Another is to recognize the good practices and appreciate them rather than wait for them to make mistakes. I talked about adolescents especially and expectations of their parents, of especially the older children. Most adolescents complain that parents don't understand them, don't appreciate them, and never notice when they are trying. So one of the things that counselors can do is help the parents to recognize good practices and to appreciate them rather than wait for them to make mistakes and point them out. And it doesn't have to be on the assignment they have given the children, but to be observant of their children. Another is to reassure them of safety, to reassure them of their safety, to explain, you know, children are being made to feel like they cannot do so much because they have to keep safe. They can't go to the shop, they can't do so many things. Reassure them of safety. Explain the guidelines given by the Ministry of Health and the World Health Organization, that if you wash your hands, if you have a mask, if you have a sanitizer, if you don't touch yourself, you are safe. Because most children are anxious. They think they went to the shop, they have touched something, therefore they are going to have corona. So it's important that you assure them of their safety so that they can have a better time. And then children are a bit lonely. They are not able to do many things, and most caregivers don't even have the know-how or even the time, because working from home is as hectic. So being creative, okay, and with the children can teach and the parents can learn. being creative with them during this anxiety time of COVID will help them come up with so many things. They can learn new skills, they can bake, they can play music, they can learn dances, they can learn to sew. There are so many things that can help children come up with, which will allay their fears, will keep them away from focusing on only COVID-19. I want to say thank you for listening to me, and I would say more, but we don't have time. I am recognizing that time is running, so please type in your comments. Please say what you want to ask. At the end of it all, we will answer it. Thank you very much.
Wow, a big round of applause for Mrs. Ruth Matoya. We are very glad and we're very happy. The presentation was very wonderful. Surely, anxiety. Now, for sure, I know that anxiety is an emotion characterized by feelings of tension, worry, thoughts, and physical changes. I like the way you discussed the characteristics of actually the signs that shows that a child is anxious. You know, children are very critical human beings. It's not very, very simple to handle a child. Sometimes we don't know what they are feeling. Actually, I've known today, no wonder why my small child here is bedwetting. Could it be anxiety? Mrs. Ruth Matoya, just a quick one.
It mostly is anxiety most of the time when they feel that they are overwhelmed by certain things. Everything in a human being reacts differently, and the body remembers so many things. So even in sleep, the kids have got their fears. Maybe if they fear a monster, they may fear to even go out and ease themselves in the night. So they will fall deeply asleep in trying to forget the monster, but they will also not remember that their bladders are full. So most children that are experiencing anxiety due to anything, not just COVID-19, one of the things that you always notice is that they wet their bed, most of them.
That's amazing. It's a wonderful insight for sure.
I want to put a clause there that between 0 and 5, it's allowed because their sphincter muscles haven't developed well enough. But if they go beyond 8, then you begin to ask a lot of questions why they are wetting the bed.
Surely. That's very amazing. Actually, when I look at my right hand here, at the chat room, very many people are appreciating your presentation. Like Councillor Patricia Bako is saying, thank you, Madam Ruth. Dr. Vic Owens, well prepared and presented, Ruth. Thank you. Mrs. Susan Badagawa says, thanks, Ruth. And Miss Consulas Ruanyonga is saying, thank you very much, Ruth. The presentation was clear and well.
Thank you for appreciating. Thank you very much.
Yeah. In fact, there are very many. Miss Patricia Bako is saying, this explains why my daughter keeps asking me when COVID will end for school to reopen. Miss Gladys Ananura is saying, just to give an example of what I have seen with children around me, they always ask, if I eat vegetables, will my body fight COVID-19? Maureen Nakarima is saying, thank you very much for the presentation. All right, that was Mrs. Ruth Matoya for you from Healing Talk Counseling Services. What I know, Healing Talk Counseling Services is found in Nakawa, Akamwes building, off from MOBS, just from MOBS. There is Akamwes building. That's where you find Healing Talk Counseling Services, where Councillor Ruth Matoya is one of the directors and counselor there. with a very wide expertise when it comes to children and, of course, other issues in counseling. My name is Kakinda Adrian. Allow me to welcome you once again. Welcome aboard. This is the first ever online counselors fellowship, first of its kind in 2020. I bring you greetings from the Uganda Counselling Association board. The president is with us. He will say something after Councillor Miriam Rose Senkungu Biyinzika. Hope I've got your names very clearly. Our second panelist tonight. Now, Miss Miriam Rose Senkungu Biyinzika is a counsellor from Chambogo University Medical Center. Is going to handle anxiety in the adults. You know, Miss Ruth Matoya was handling anxiety in children. Allow me to welcome Miss Miriam Rose Senkungu Biyinzika. Hope I've got your names clearly for being safe. I don't know. Sorry, hello?
Yes, you have.
Okay, the floor is yours.
Yes, you have.
All right, the floor is yours.
Thank you so much, Mr. Adrian Kakinda, our PRO, the president and fellow counselors on board. You're welcome for our very first of the kind. Like have been introduced, that's my name, and I'm very happy to be here. Can you hear me? Can you hear me? Thank you. Yes, and I want to thank the precurrent, no, thank you so much. I want to thank the precurrent speaker. It was quite a very good presentation. I have loved it, and it has taught us a lot. So today, we are still looking at the same topic, that is anxiety, but we are going to look at anxiety in among adults. Looking at this COVID-19 pandemic, a lot is happening to us as adults. A lot has changed. We've been hearing about the new normal, and we are wondering what exactly new normal is. How do we live with the new normal? How do we see that we keep on? Because as adults, we are not like children. We are expected to keep on providing for our families. We are expected to keep on making ends meet. And when these children look at us, like the precurrent speaker was giving examples, they look at us as superheroes. We are their heroes of a kind. So we are put on pressure to do what is expected of us.
Hello,
yes,
hello,
this comes
hello,
quite.
hello, hello,
Hello? 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 Hello?
We hear you.
Thank you. Someone was saying hello, so I thought of not being clear. Yes, so what I was saying is we are expected to do quite a lot, and all this is on us. So this causes anxiety because, like we've had, anxiety is a normal response to anything new, anything that may seem frightening, anything that looks stressful. And this is what we are going through. COVID-19 looks stressful, it looks frightening, it is a new situation, so anxiety is inevitable. But in a situation like this, where anxiety is inevitable, what next? Because like I said, yes, we are adults, not like children, and we are expected to do what is expected of us. And looking at this, first the outline, we shall look at how anxiety manifests or presents. Then we shall look at the tools that we use when assessing anxiety or diagnosing anxiety. And then we shall also look at the problems associated with anxiety together with the interventions. Because after us knowing how it manifests, how we can assess it, the problems that come with it, definitely we need to know how then shall we help them. And we as counselors, a lot is coming to us. So we need to know, while these clients come with all their hope in us, what next? How do we help them? And looking at first an introduction, we have very many types of anxiety disorders. And it becomes an anxiety disorder where one, it is affecting someone's day-to-day life, or according to DSM, they show that if it has been persistent for about 6 months or so, then we can call that an anxiety disorder. So these types of anxiety disorders range from generalized anxiety, social anxiety, separation anxiety. That happens when one has been separated from people they love or things they love doing. For instance, right now we have people that have been put in quarantine centers. Chances high their families, together with themselves, are going through this separation anxiety. And as I was reading, I realized that this affects children so much. However much it also affects adults, it affects children much more than it does to adults. Then we have panic disorder. We have phobias. Those are very many. There are very many different types of phobias. And then anxiety disorders that happen due to a medical condition. Maybe I'll give an example of people that have epilepsy.
So, excuse me, Mrs. Miriam.
Yes,
I guess you want to share us with your presentation, but it's not showing. I don't know.
It's not showing. Let me try to fix that.
I think first load it and see.
Let me fix that. It's not showing.
Yeah, that is good. Even me, I was not seeing.
Sorry, let me fix that. A moment.
Okay, then we are fine.
Can you now see it?
Yes.
Okay, thank you so much. Thank you so much, Adrian. Well, as I was saying, we're talking about the types of anxiety disorders, and those are the types that we've been going through. And I was talking about anxiety disorders due to a medical condition, where I gave an example of people that could be having right now, people that have been diagnosed with COVID-19. This causes anxiety to them. And then we have people with chronic illnesses that have chances of heightening in such situations. For instance, clients with epilepsy, clients with HIV due to the worry, anxiety, and others, their viral load is most likely to drop a little, and very many other chronic illnesses. So they may end up having anxiety, but due to that medical condition. And then we are looking at how anxiety manifests or how it presents. And then we have excessive worrying. Excessive worrying, this is when someone worries out of proportion. It could be a small issue, an issue that one could not even worry about. But because of anxiety, they could look at this issue as something big, bigger than they think it is, and hence it's a sign of anxiety, because many times they come reporting these issues. So these are the issues that we use to get to assess or to get to diagnose anxiety. And the other thing is feeling agitated. Many times when a client is going through this moment of anxiety, putting in consideration right now, as we have a COVID-19 pandemic, many people are expected to get agitated, even over issues that may not necessarily call for that. But because one, they are getting numb, their usual coping mechanisms are losing it. This calls for feeling agitated. Then restlessness. Restlessness, this is when someone basically is not relaxed, I'll say. Someone can't relax. We've been in situations where they'll tell someone, please relax. But this person fails to relax. Why? Because of a lot that is going through in their minds. And then someone feeling fatigue. Many times this person may not even have done as much as they could have been doing, but because remember, anxiety happens in the mind, it is psychological. And as it happens, the brain needs power to handle what is going on together with the body. So this causes fatigue. Someone will feel fatigued even for no sincere reason. They'll come telling you, counselor, I feel fatigued all the time. I've tried medication and whatsoever, but it's not really working for me. And then someone could have difficulty concentrating. This difficulty concentrating usually happens because of their mental health state. And irritability. I think this gives reason as to why we have very many issues of violence around us during this time. Everyone is irritable. Everyone is losing it. So over small issues, over issues that may not look really big, you find people fighting, people killing one another, people are being suicidal, and very many others. It is one of the manifestations of anxiety. And then we've talked about muscle tension. Muscle tension happens because one, when someone is anxious, like I said, their bodies are at work. Someone's adrenaline will go high. And when someone's adrenaline goes high, the body works in a way that it has to see that your adrenaline goes low, or it has to see that you respond to whatever it is. You either go into a fight mode or a flight mode. So because of this, many times there is muscle tension that comes in. And then we also have social withdrawal. This is very common with adults that are going through anxiety because one, we don't know what is causing this anxiety. Looking in the situation that we are in now, you may find someone has lost a job, the children need their needs, the rent is needed, or we have people that we are working with, arcades and others, and these people were on a lockdown for quite a long time. Yet these are people that were working hand to mouth. You know, they were living a life of from hand to mouth. So here comes the time when someone will, feel tired of whoever is around them because they are irritable, because they are going through a lot, and they feel even people around them are either increasing on their anxiety or not helping at all. For instance, they could be children, you know, or it could be the wife who is asking for salt and soap and sugar and etc. So because of that, someone will choose to isolate themselves from others. And then we have sleeping disorders. For example, insomnia is a very common one here, where someone loses sleep. A client may come reporting issues of lack of sleep or having to wake up very many times during the night, not because they do not want to sleep, but for some reason they lose sleep. And this reason is usually because of what is going on in their minds. Like we said, this is brain power. They are thinking about very many things. They are having worry. So because of this extreme worry that is even now becoming chronic, someone experiences a sleeping disorder like insomnia where they lack sleep. And then we have eating disorders. Many times eating could be either a source of comfort or not. So if someone finds eating as a source of comfort, then they will do too much of it. They'll eat something that is out of proportion, not for them at a given time. For instance, you may find someone eating food that is meant to be for maybe 3 or 4 people, and they are having it alone. Why? They are finding comfort in that. And then at times, people withdraw from eating. Someone may choose not to eat at all. Why? Because they feel stressed, they feel worried, and a lot is going on in their minds, so they choose not to eat at all. And at times, it could even be appetite loss. Because let's look at a client who maybe was on the lockdown for a very long time, for instance, the border riders, saloon people, and others. And this person has a family. This person at times even has someone in quarantine or someone who is infected with COVID-19. So with all that in their minds, many times someone may lose appetite. So that is also a reason as to why someone may end up having these disorders. And yes, we are now going to look at the tools used to assess anxiety. Before we get to know that, yes, client X could be having anxiety, or before we get to know that, oh, all the time this person has been struggling with anxiety, because these manifestations may be for either anxiety or any other mental health issue. We need to assess such that we bring out the professionalism in us. And these assessment tools are what differentiate us from any other person that may call themselves a counselor. And the first one we have is the brief fear of negative evaluation scale. This one is used to evaluate negative fear or the negative feelings that a client may be presenting with. And then we have the depression, anxiety, stress scales. This one basically is used to assess depression, anxiety, and stress, because sometimes all these three may present at once in the same client. And we have what we call generalized anxiety disorder questionnaire. This one is used to diagnose or assess generalized anxiety disorder. And then we have generalized anxiety disorder 7. Generalized anxiety disorder 7 is used in relation to the ICD anxiety, how to assess it, how to stage it, and the like. And then we have Hamilton Anxiety Rating Scale. Hamilton Anxiety Rating Scale, as I was going through it, I realized it's one of the easy to use anxiety rating scale. In an era like this where we are doing online counseling, it can be used online. You can even share it with the client. If they're genuine enough with themselves, they can go through it, giving you responses, and then you look at the scores and you get to know where exactly someone is lying. And then we have Leibowitz social anxiety scale. That one is usually used to assess social anxiety within the clients. We have overall anxiety severity impairment scale, hospital anxiety and depression scale. Hospital anxiety and depression scale is very crucial for especially clients right now that have been hospitalized because of issues of anxiety and others.
Just a moment, Madam Miriam.
These can be usually found in rehabilitation centers.
Excuse me, Madam Miriam.
Yes, please.
Some members are asking to put your...
Yes, please. Yes, please.
Some members are asking you to put your presentation, your slides in the presentation mode. Is that clear with you?
I can't get you.
That you put your slides into presentation mode.
I didn't get what you are saying.
That you put your slides in the...
I put my slides into presentation mode.
Yes. Is that clear?
They're now there,
Let me do
Adrian.
that. Let me
Sorry?
do that.
Okay.
Yes, yes, it is. Let me do that.
Hello?
Hello.
Yes, I'm no longer hearing you. What is happening?
I'm responding to putting my slides in presentation mode.
Go to slideshow, Miriam. Go to the thing that says
Here we are.
slideshow.
Here we are.
Great.
Can you see them now?
Yeah, proceed.
Yes, thanks.
All right, thank you so much. Well, I was talking about the hospital anxiety and depression scale, and I was saying that this is very crucial and very needed for many of us that are working with hospitalized clients that are manifesting anxiety. These could be found in maybe rehabilitation centers. These could also be found in mental health illnesses, like places where people with mental health are found. For instance, Butabika and very many of the sort. So that is what it works with. And very many others. You'll allow me share a write-up with our PRO who will send this to our emails on here for us. It will take quite a lot of time. Hope that's okay with the members. And then we have problems associated with anxiety. Like we said, anxiety many times is psychological. Many times it happens because of what is going on in our minds. And many times this is amplified. The reality of it could not be as big as what we are going through in our minds. What am I trying to mean? For instance, it could be a very small flu. Right now, if someone catches a very small flu, a usual cold, someone may simply call that, you know what, COVID-19. And before we know, someone may say, wow, I think I've got COVID-19. But this person could just be anxious about getting COVID-19, or maybe it could just be due to anxiety, but it could not be the reality of what is going on. And the first one, we are looking at problems associated with anxiety. I tried to group these into psychological and others, as we shall see, where we have the first one is depression. Most of us have interfaced with this word as professionals as we do our work, and depression usually moves hand in hand with anxiety. It is difficult to assess a client with depression and they don't have anxiety with them. If we even look at the manifestations, many of these look alike. And then we have what we call sleeping disorders. I gave an example of insomnia. So many times if someone is having anxiety, they may tend to lose sleep. And then we have suicidal tendencies or thoughts of self-harm. For instance, given a situation like now where very many people have lost jobs, very many people don't really have an earning right now, and yet the needs are still as they are. Bills are still on, rent is still on, the children are still around us, and very many other dependents. So given such a situation, one may think of, oh, what am I still doing? What is even my reason being here? And in that way, someone may think of suicide or even self-harm and feeling worthlessness. Many times when someone is having anxiety, before it proceeds to being diagnosed as anxiety disorder, they try out the usual coping mechanisms around them. For instance, we all have the way we cope to very many issues. We all have what we use to cope with given situations. Now, in a situation like COVID-19, you realize people are saying, no, let's just get used to the new normal. That could be a coping mechanism. Someone may be trying out exercise. I remember when we were going through lockdown, the first few weeks, we had very many people storming the streets and they were exercising. But I'm sure many of these were trying to cope with what was going on. So, given a situation where all these coping mechanisms fail to work for a given individual, this person may feel not of worth. And then excessive worry and frightening thoughts. Currently, adults are really worried. For instance, if someone has lost a job, they are wondering what next? Will I even get this? Does not go away. You know, those are the thoughts that people are having now. If COVID stays with us forever, the way malaria came, the way HIV, TB, and others all came, what next now? What can I do about it? Yes? So this excessive worry is also a problem that comes with anxiety. And I won't stop saying that many times this worry is out of proportion. And that's something we should always look out for while dealing with our clients. And then we have social problems associated with COVID, with anxiety, where we have social withdrawal. This was mentioned earlier under the manifestations. And social withdrawal, like we said, many times someone will tend to withdraw from others. They'll tend to isolate themselves. By this time, not the self-isolation due to COVID-19, but because of what is going on through their minds. Someone could find peace when they are alone, I will say that way. Because when they are with people, needs could be very many around them, or even the expectations of others. So in a situation where an adult can't meet the expectations of their dependents, the expectations of the landlord, and very many others, the best thing one may decide to do is to go into social withdrawal and choose to be alone, flee from close friends and family, and find themselves alone somewhere. And then we have substance misuse. Many times, this substance misuse comes in as a result of mental health illnesses. I usually share with people and I tell them no one wakes up one time and they choose to misuse a given substance. No. Usually it is because of what is going on in their lives that they choose to Usually it is what is going on in their lives that they choose to use a given substance. And like we all know as counselors, many of these substances help to heighten one's mood. So where in a situation where someone is having low mood, where someone is having depression, at times they could even be having delusions and others, they may choose to use one of these substances purposely to heighten their mood, for them to feel a little more better. But the issue is these substances are not helpful for a long time. They only help for a short time until the substance itself now also becomes a problem to the individual. And then we have delusions and misconceptions about society. Delusions are usually negative feelings or beliefs that one has about self or about others, but many times it's about self. For instance, someone may think, oh, my family no longer likes me. Maybe because this person is not doing as expected, they are no longer meeting their needs, maybe financially, emotionally, and the like, and they choose to say, no, my family no longer likes me. And before we know, no longer likes me moves to my family is against me. Before we know, my family is against me now moves to something else. Maybe my family wants to take my life or something of the sort. Yet in actual sense, all this may not be happening, but this person is feeling this. And we've talked about misconceptions about society. For instance, currently, if you looked at social media, there is a lot going on. Very many misconceptions. First, about COVID-19, where someone says, no, I think this thing was invented by some people on purpose to kill others. And someone will say, no, I think this thing was invented by some people on purpose to get rich and other issues of the sort. So many of these are myths, many of these are not true actually, but many times when someone is anxious, they have very many questions in their minds and they try to find answers to the questions. So those could be the reasons that lead to the delusions and misconceptions about society. And then we have avoidance of some situations or people. This is very common with clients that are having phobias, the very many types of phobias. If a client is having phobias, many times they will tend to avoid situations that may trigger these phobias or people that could trigger these phobias. For instance, if a client at one point interfaced with someone who had COVID-19 and they had to go into a quarantine center for 14 days or more because they were cited as a contact to this person, others avoid being with others, or they may even avoid the situation where they met this person. For instance, if it was a barrier, someone may choose to avoid going there, even when invited or even when is supposed to be part of it. So we have problems associated with anxiety, but now we are looking at how does anxiety become a problem to our relationships, our interpersonal connections, the way we connect with one another. Like we all know, we all need to connect with one another. We all need someone. That is why even in this situation of COVID-19, we've tried to look out for apps like these ones we are using today to see that how do we keep on connecting with one another? Because like the old saying goes, no man is an island. We need one another. So if our interpersonal relationships are crippled, then there is a problem that needs to be dealt with. And now the problem we are looking at is anxiety, where we have the loss of connections with family and friends. We all need friends, we all need family. And this comes in as a result of social withdrawal and pressure for reassurance from close people. Many times, if someone is having anxiety caused maybe due to a phobia, they'll be putting people around them on pressure all the time. Please tell me, is this going to happen? Is it this way? Like I gave an example of someone who happens to interface with a person who is diagnosed with COVID-19. This person will end up being on pressure, like putting others on pressure if they happen to go out again. For instance, if they met maybe in a marketplace, if they happen to go to the market again, they'll be asking people around them all the time, please, I've had someone sneezing. Are you sure that is not COVID? And the like. Someone is raising their hand, I don't know. I think, okay, it's fine. And a difficulty to initiate or deepen connection with others. Many times, clients that are suffering with anxiety will tend not to be in position to connect freely with others. This is because of the issues we've mentioned, like the worthlessness they have, because of the suicidal tendencies going around them, the depression, a lot of things in there. So because of that, they tend not to be in position to initiate or deepen a connection with others, even when they would want to, even when they would want to have friends, even when they would want to start relationships, they find it hard. Why? Because of the anxiety that they are struggling with. And the other one is marital distress due to decline in relationship satisfaction. I think this gives a reason as to why we are having very many issues of gender-based violence in homes today. This could be because of marital distress due to all that is going on, like I lost a job or maybe suffered a salary cut, and here are people around the home that are still putting him on pressure please, we need salt. The next time we need food, and then we need this and the other. So before we know, many times such things may lead to relationship dissatisfaction, where the people around, like in this case, the wife may feel this person who is the husband now is not doing enough to sustain the relationship. It's not doing enough to sustain the family, and hence marital distress. And then we have vulnerability among close friends and family members. Like we've said many times, people struggling with anxiety will want reassurance. Actually, they'll put people around them on pressure for reassurance over and over. If it is phobia, and maybe this person had a motor accident at one point, still they'll keep putting someone on pressure if they happen to travel by car. Please assure me nothing is going to check your car. And many times this makes them look vulnerable. And as we know, many people don't want to stay around people that are vulnerable. So before we know, this person's relationships may have issues. The connections they have with family and friends may end up having issues, as many of them may not want to connect with them because of that issue. And then we have interventions that we can use to manage anxiety. Looking at this whole discussion, we've seen the types of anxiety disorders. We've looked at how to assess anxiety. We've looked at the manifestations and the problems that anxiety comes along. And then we need to look at what next. Well, how then can we help out ourselves and other clients that are managing or that are suffering with anxiety? And the first one is encouraging good self-care. As a counselor, how do we encourage good self-care? Usually it is better done by drawing a client's self-care plan. For instance, if this client has been keeping in bed or to themselves for 2-3 days, then we have to draw a plan of, okay, how then are you going to manage your time? Are you going to take time exercising? Are you going to take time drawing something? Are you going to take time singing? What are you going to engage in that is good to yourself, such that this client takes care of themselves? Remember, we said many of these clients are struggling with feeling worthlessness. So they need good self-care plans such that they take good care of themselves, and they also identify that hidden potential in them as they engage in these self-care activities. And then the other thing is relaxation techniques. Relaxation techniques are usually meant to help the client relax. Like we had said, someone could be restless. This person has worry. So the way we can help this person relax is engaging them in relaxation techniques. For instance, it could be counting, breathing, reciting a verse, singing a song, and very many others. Depending as we engage the client, we get to know which kind of person are they. If they're a person that loves singing, can they use that as a relaxation technique? If they're a person that loves drawing, can they engage in that? If they are a person that enjoys the breathing techniques, can they engage in these? However, some of these relaxation techniques should only be done after a given training, especially by us as counselors. Because these, for instance, the breathing techniques, we may need someone to take us through them, and we get to understand them before we start practicing them or helping clients go through them. And then we have learning about anxiety. Many times, clients do not even know that they have anxiety. That is why, like I said, when they come, they don't say, hey, counselor, I have anxiety. No, they'll come presenting other issues that we've looked at. Then you look at these issues versus what your assessment sheet, and then you compile, and you get to realize that it is anxiety. So we help them learn more about anxiety. And in this way, looking at an era like now where we are using online counseling, Even a client may be in position to manage some issues on their own, even without a counselor. And then we look at mindfulness of situations that may trigger anxiety. Anxiety usually is triggered by very many issues. Very many issues cause this worry, this stress that is usually out of proportion. So we should help counselors, we should work with them to identify which situations are these that cause anxiety and how should a client go through them. For instance, if this client has lost a job and they are going through anxiety purposely because of that situation, how do we see that this client gets another earning? And the sort. And then cognitive restructuring. Like we talked about these people feeling worthless, people having suicidal tendencies, and very many issues that may need cognitive restructuring. Now, when we are looking at cognitive restructuring, basically we look at how do we replace the negative thoughts, the irrational thoughts this person has. How then do we replace them with the rational thoughts? For instance, if someone gave a counselor a call, or if someone walked into a counselor's office feeling not of worth, how then can we see that this person lives feeling that they are of worth? And if they are feeling not of use, maybe because of what is going on in their lives, how then can we see that this person, by the time they leave, they have these worries are blown out of proportion? And we have behavior therapy. This is a very common one to us as counselors. And what we look at in behavior therapy is how do we manage negative behaviors? Behaviors that could not be helping to us, behaviors that could not be helping to our mental health state as counselors, as clients. How then do we engage in behaviors that would be of help? Restructure one's thoughts, one's feelings and cognitions altogether. With behavior therapy, we are trying to see that how do we replace behavior that is negative, behavior that is not of help to one's mind, with behavior that is of help to them. And the other one is counseling. This is a talk usually. It could be a one-on-one talk. It could be a counselor meeting a number of clients. And through this, many clients happen to open up. Many clients happen to be helped in very many ways. And building self-esteem. Like we said, I'm not going to get tired of reminding us that many times anxiety is due to worries that are blown out of proportion. Many times it is due to issues that may not be as big as we tend to amplify them. So under this situation, many times clients need to boost their self-esteem. How do we show them that they are of worth? How do we help them discover their inner strength? That strength that many of us have within us, but we've not yet put it to use. We've not yet put it into action, because many times we even don't know that we have that strength within us, what we call someone's inner potential. So how do we help a client discover their inner potential so as their self-esteem is heightened? And then we also have structured problem solving. When we look at structured problem solving as counselors, we realize that many times when a client comes, their problems at times are too many, and even their story is jumbled. For instance, someone may come telling you, now you see the kids came back to school, and after that I lost my job, and after that my auntie died, and by the way, they didn't allow us to bury her because she had COVID. And so how do we do what I may call detangling? How do we untangle these issues one by one? And how do we get to the root of, okay, what is the basis of all this? What is causing these very many problems? And how do we tackle this issue one by one? Many times the best way we do this is engage the client. Many times I'm sincere with them that, you know what, as we were talking, we talked about your auntie that died of COVID, we talked about the children that are at home, we've talked about your landlord, and very many others. So of these, what can we handle first? Which one do you feel is your most pressing that we need to address immediately? So because of this, they'll tell you that, okay, it is because of this that this has happened, and I think we should deal with this first. And that's how we started. And then medication. When we look at medication, many times these are drugs, but I'll put it to us that as counselors, we are not allowed to give clients those drugs unless we do it together with a team. For instance, if a counselor is working with a doctor, a psychiatrist, a clinical psychologist, etc., then under that team, we can work with them to assess which client may need this medication and how do we give the client to them. And the other issue we can also look at is the adherence issue still under medication. Because many times when these people are given this medication, looking at now that even the transport costs are high, we may not be there in their homes or around them all the time to ensure how do we help these people adhere to the right dose, taking the right drug at the right time, such that we see that there is a positive change in their lives. And the other issue is engaging in support groups. Many times when a client is going through anxiety, they may think that they are going through this alone. And this happens because we as humans tend to have a mask. You never know what is beyond that mask unless we let someone know. So someone may look at people around them and they all seem happy. They all seem to be making ends meet. They all seem to be excited and all that. So one may feel they are alone in this situation. But if a client happens to engage in support groups, if they happen to meet others in such a way, they get to share with them, they get to identify very many and how they have managed in relation to what is going through in their lives. And in that way, this helps clients manage anxiety that they are going through. I want to thank all of us for being together in this first fellowship of the kind. It's been a nice opportunity. And as you can see on the screens, I'm a counselor. I work with Chambogo University Medical Center. And allow me to open the platform to our PRO and others that may be having questions.
Wow, a big round of applause for Councillor Miriam Rose Senkungu Binzika. Wow, what a multitude of names this evening. Thanks very much for that wonderful presentation tonight. And to the participants, by the way, I cannot let it go as if it's just something usual. I'm very proud of the counselors on board. People are clapping, people are giving you thumbs up, people are live or almost all over the world. Thanks for those people who are watching us via our Facebook page. It's quite, people are buzzing there. People are trying to give in their kind of comments from the first presenter, Miss Ruth Matoya, and our Councillor Miriam Rose Senkungu. What was funny when Miriam, you were presenting, Councillor Chosaba Winifred said that, you know, I'm very proud to be facilitated by my mentee and mentor. So that was very, very amazing. One of the amazing comments here. All right. Now I can, let me get some like 4 comments or concerns. Some people want to leave. Miss Ruth Matoya is having another kind of engagement. Anyone with a question for Mrs. Ruth Matoya before she leaves? You can tap in. You can just tap in on the chat room, and then I see your concern. And before we let her go, Mr. President Gaston Biamugisha, you're the next on the agenda to give us something, something about Uganda Counseling Association at large and the members who are watching right here in Uganda and almost in the region and some parts of the world. Surely this is something which is very historical of a kind. My name is Adrian Kakinda. For those who don't know me, a born of the newly formulated city, that's Masaka City. I always I always feel proud talking about that. All right, someone is saying as we leave, can we open our cameras and we wave at each other if possible? No problem. It's something very possible. It's networking actually. I'm meeting some people I've not met before. Indeed, it's very wonderful. Now, this one goes to Madam Ruth Matoya from Mary Kampogo. Dear Matoya, how do you help a child 10-year-old who fears sleeping without lights on? That one.
Okay, thank you very much. I want to say that when a child has unfounded fears, according to the parent, there is something that hasn't been resolved in his life, and you can only find it when you engage the child. You may have to talk with the parents around what his fears are, but a 10-year-old is very expressive in play, he's very expressive in art, he's very expressive in the way he writes stories. So you can help a child to bring it out. Even if you were to tell him to write about the friend who fears things, he will bring it out, and then you will be able to discuss that cause of that anxiety. And
All
then
right.
you can use cognitive restructuring if you know about what is causing about it. You can also help him to construct safety, to have a calm, safe space when he is going to sleep. Either he forms it in his mind, or he draws it, or he expresses it himself. Yeah.
All right, thanks very much, Mrs. Ruth Matoya. I have no problem. I think now it's okay for your next engagement. We are very humble and proud of you, Ms. Ruth Matoya.
Thank you very much. May I wave to everyone now?
No problem.
Before I leave the meeting. Yeah. I'm happy to see you, counselors, everyone else. Thank you very much. God bless you, and may we see each other another time. Thank you.
All right.
God bless you, Ruth. Thank you.
Thank you. Thank you. Thank you, Wilfred, my students. I can all see you all. God bless you so much. Yeah.
Thank you, Mama. We love you.
Thank you.
Yes.
That's very amazing. All right. I think now this one can be handled by Miriam. Someone is saying, I have a friend who has been struggling with alcohol disorder, has been in the rehab and relapsed for 3 times now. He says he has anxiety as well. And I recommended a mindful app from Play Store. Is it as helpful as one that you agree upon with him physically? Miriam, that's for you. That question is going towards you.
Well, thank you so much. About a friend with alcohol disorder, well, many times the best one can have is a one-on-one talk with a counselor. But in situations like now, where at times transport issues, then the pandemic itself, it could be hard for this person to engage with the counselor physically.
All right.
But maybe what you can do is know more about this app. How is it working, and who exactly invented it, and what are their goals? Are they looking for money? Is it managed by professionals or something like that? And the other thing, I'll also recommend that this person engages in AA meetings. At least they are having now meetings that are online. These meetings can join their groups via Facebook, Instagram, and the others. It will be helpful for them.
All right, thanks very much. I would like to welcome Dr. Ruth Senyonyi. I'm very glad, one of the past UCA presidents. You're welcome, Mami Ruth Senyonyi. Allow me to welcome Mr. Gaston Byamgisha in the remaining few minutes to give us a brief about Uganda Counselling Association and perhaps what's happening. Welcome, Mr. President.
Thank you very much, Adrian.
Yes.
I'm very excited. Initially I had technology issues. I kept losing the connection, but I think eventually I figured out how to do it. Thank you very much, Miriam. Thank you very much, Ruth, for your presentations and the research that went into it. It was fabulous. And I want to thank all those of you who have attended. I was checking through. I saw Dr. Vicky Owens. I saw Dr. Ruth Senyonyi. I saw many other people online, and I think this is wonderful. So to the members who have attended, we are exploring this idea for the annual General Assembly, our annual conference. We would want to get your views on whether this mode could work for us. What are the issues that we need to address so that we can be able to use it for our annual conference? So please, not only do you look at the presentations, but also give us views on the mode or the method itself and how we can use it for other things for the annual conference. Otherwise, thank you very much for attending and all your comments. We are very, very excited about it. Thank you very much. Back to you, Adrian.
All right, thanks very much, Mr. President, Gaston Byamgisha, speaking live from State House. All right. Okay, a few briefs right here before I let it go. We shall have our annual general meeting this year, regardless of the situation. If the situation permits physical meeting, then we shall meet physically. But as things are moving on, we may have our annual general meeting for only registered UCA members on Saturday, 12th of September. So 12th September, Saturday, we shall have our annual general meeting. Of course, to see how all it goes. It will only be for members who have updated paid up membership. So we encourage members to go renew their membership at the office. The UCA offices are open 24, they're open in the normal working hours, Monday to Friday. So 8:30 to 5 p.m. And of course, we also got a new administrative secretary, that is Miss Martha Acheng. So she's always there at your service, whereby you can link up with her and then try to update your membership as we wait for the annual general meeting. Now we shall have more and more fellowships like this. We are planning for another fellowship in a few days to come, so we shall keep you posted. And I'm very glad that even our social media platforms, you are following them, and Facebook, Uganda Counselling Association, Twitter at Counselling UG, and very soon we are opening our YouTube channel. And of course, for checking in on our website, that's www.ucaug.org. That's our social media platforms and our international network platforms. I think that's it. Now, for those who want to wish to each other, you can open your videos and say hi to your colleagues before I call it a day. Some people want to continue with their Eid celebrations, so I would like to release them and they continue with their celebrations. So you see, it has been quite very long. Hi, Miss Joy Ebong. Yeah, very amazing.
Hello.
Yes.
Oh, hi, Mary.
Hey, how are you, Dr. Ruth? Good to see you all. Hi, Consul.
Hi, Dr. Ruth. Hi, Dr. Vicky.
Hi, Dr. Vicky.
Hi.
Wow, where are you, counselors? You're in a very nice place.
Yeah, it's very nice.
It's a virtual background, doctor. It is just a borrowed background.
I was like, wow. Where are
Relaxation mood.
Yeah, and others, Mary, Choshama, and others. Yes, Mary.
Miriam,
I've
thank
seen
you
you.
for teaching us.
Yes, yeah, Mr. Gaston, I've seen you. Yeah.
All right, that's very amazing.
Yeah, nice to see you all.
All right, from the entire team right here, the technical team, thanks very much for the entire UCA board. Mrs. Susan Badagawa, who has been our chairperson, organizing all this. Allow me to wave to you.
Yeah.
And allow me to say have a good night, actually.
Night.
Good night, thanks.
Bye.
Bye.
Have a great weekend.
Thank you very much.
Thank
Good night.
you.
Nice
Bye.
weekend, everyone.
Yeah.
Yeah.
Okay.
Thank you.